Besides sleeping wrong, it can cause neck, shoulder, back, hip, or knee pain. You're on your shoulder like this, and you're gonna go down like this, and you're gonna have your head bent like this all night long. It's better to have two pillows that fit correctly. Now this is a little bit too much for me,
Right.
but I have a Sleepovation pillow, by the way,
Yes.
and I have just a thin pillow underneath,
Sure.
and that is the right combination for me. You want your head in neutral. We call it. You don't want it bent this way, and you don't want it bent this way. So if the pillow's too thick, you're going to be bent off the wrong direction, and if it's too thin, you're going to be this way.
Sure. I just want to mention your pillow might be the right thickness and able to fold it in half, possibly. It all depends. It's just something you could try.
So what you do, you take a throw pillow. This is the canal.
I
right
see.
Here.
Yes.
And you put your shoulder and arm right in the canal. And now you got some of the pressure is on your head and some of the pressure is on your thorax. So it would be your chest. And it's taking pressure off the shoulder. Now, again, this pillow is not quite thick enough. If it was a little thicker, you could see that it's taking pressure off the shoulder. If you sleep ideally, you don't sleep on the painful shoulder. And this is what you do then. You actually lie on your side. You actually put one pillow, like right here, and you put the other one under the arm. Because what happens if you take this one out, look what my arm, on your neck sometimes, by the way, some people do use a neck roll.
Yeah.
If you've seen that, Brad,
yeah.
Put it in the pillowcase.
Yeah.
And it works like this. You can start off with a rolled towel.
Sure.
Same thing for the back. When I'm on my side, if you don't have any support, and if you're having back pain, your back is actually, can you show how it's kind of curved down like this? Maybe on the spine.
So he's lying there. The pelvis bone is like a bridge here. The shoulder's here. And what happens is there's a hollow spot between the ribs and the pelvis. And you get this bend
down.
And that's why I cannot lay on my side.
If you have that situation, you actually can take a rolled sheet and tie it around you.
Yeah.
And it'll actually give you support on your back when you sleep on your back also. It gives me support on my back.
Yep.
Also gives me support on my back if I want to lay on my back.
Right.
Lie on my back. Let's say you have a hip pain. And I had this one. This is the one I had. And I used to sleep like this.
Yeah, like a pretzel. Your legs
like
are
a pretzel
up, yeah.
And I found that comfortable. This is stretching the hip all night long.
Yes.
Maybe even impinging it a little bit.
In the front,
yeah. So I had to get in the habit of stop doing this because I was stretching out that muscle, weakening the muscle, and it's purely a habit. This one, believe it or not, helps the back because it stops the back from twisting.
Yes.
And it also helps the hips for what we just did. It stops that. And it helps the knees because the knees are bumping together in there.
Especially if you're a thinner person, you got bony knees.